Hello viewers, welcome to another vlog. I'm Dr. Joydev and welcome to my YouTube channel. Today's topic is reactive lymph node. But before going on to today's topic, let's understand first what is lymph node. Lymph node is a key part in our lympho-reticular system. Our lympho-reticular system is concerned with building immunity. So lympho-reticular system, there is one component that is known as lymph node, and there is another component of the lympho-reticular system, that is lymphatics. So lympho-reticular system, that is comprised of lymph nodes and lymphatics. Lymphatics are also known as lymphatic vessels. Okay, so our lympho-reticular system, that is comprised of lymph nodes and lymphatics. In our body, there are numerous lymphatics. They usually drain into the main vessels of heart. So these lymphatics, they carry fluid from the periphery of our body and they drain that excess amount of fluid into the venous system of our body. And during the path, along the path, there are some node-like structures, bead-like structures, small globular structures, and these structures are known as lymph nodes. These lymph nodes are distributed all over our body. There are some regions where we usually find some enlarged lymph nodes, and one of the commonest region, that is the cervical region or neck. We usually find some enlarged lymph node in our neck. Sometimes we find those lymph nodes within axilla, in groin or inguinal region, and sometimes lymph node enlargement can occur within our body cavities like abdomen or thorax. So lymph nodes and lymphatics, they makes the lympho-reticular system, and this lympho-reticular system is concerned with building immunity, and by building immunity they usually protect us from foreign invaders like bacteria, viruses, parasite, fungus, etc. Also they help to control any cancerous cells. That means if there is any cancer involving any part of the body, usually with the advancement of the disease, that cancer can spread to other parts within our body. In that spreading of cancer, lymph nodes, they usually limit the spreading of cancer. There are some lymph nodes within the abdomen. There are sublymphatic vessels within the abdomen which are known as the mesenteric lymphatic vessels. They also carries some amount of fat that has been absorbed from our gut. So lymph node, lymphatics and the lymphatic system has various functions to serve in our body. But today's discussion is all about the reactive lymph node or reactive lymphadenopathy. So what does it mean? So to understand that, we have to understand the function of lymph node first. Okay, suppose let me enlarge this hand. Suppose this is our hand. Okay, so there are multiple lymphatic vessels within our hand. There are some branches within it. Okay, and along the path there are presence of multiple lymph nodes. So the lymph node which are present in the axillary region or underarms, these are known as the axillary lymph nodes, and some lymph nodes are present in the elbow regions. Sometimes they are known as epitrochlear. So the main thing that I want to focus here is that extracellular fluids from the distal part of our body that is carried via the lymphatic vessels, and that excess fluid that reaches the main circulation of our body, and along the course of that lymphatic vessels there are presence of some lymph nodes. Excuse me. So the fluids are carried from the periphery to the center of the body. Now suppose there is one injury or infection or cut injury involving a distal part of our body. Suppose at this portion near the wrist there is a cut injury and there is one bacterial infection at that region. Now what happens? The bacteria that is entering in that region, it will travel via the lymphatics and it will reach the draining lymph node, where that bacteria will be subjected to some lymphocytes. Okay, so that bacteria will be subjected to some lymphocytes, and by exposure to that bacteria, to the specific antigens on the bacteria, those lymphocytes will be activated. And there are two types of lymphocyte. One is T lymphocyte, another is B lymphocyte. Now what happens after exposure with that bacteria? The B lymphocytes, they usually makes antibodies. Okay, and the T lymphocytes, they are activated and they are activated to form active T lymphocytes. B lymphocytes, they produce antibodies, and by producing antibody they are actually trying to kill that bacteria, and by making activated T cells, these cells they can also directly kill the organism. So what happens at lymph node? The foreign substance that has just entered our body, that is expressed to the T or B lymphocytes, and by expression these lymphocytes, they actually matures and they become activated. B lymphocytes, they form antibodies. T lymphocytes, they are activated to form the activated T cells, and by both these mechanisms they are actually controlling or killing those bacteria, and thereby they are protecting us. This is a part of our immune response. And in this process there is, suppose this is one lymph node. If some bacteria has entered the lymph nodes through lymphatic vessels, if these are the bacteria, so this will be subjected to different lymphocytes, and those lymphocytes will be activated. There will be proliferation of those lymphocytes. The numbers of those lymphocytes will increase, and thereby there is increased number of lymphocytes within the activated lymph node. So the size of the lymph node, there will be proliferation of the lymphocytes, there will be more and more lymphocytes, and that will make the lymph node to enlarge. So normally if a lymph node is not palpable, when it is activated, when it is subjected to any kinds of threat, then that lymph node is activated. By activation they are producing more and more of a lymphocytes. By producing B lymphocytes, they are making more amounts of antibody. By making T cells, activated T cells, they are directly killing organisms. So this is one immune mechanism. Thereby by producing this immune response, indirectly these lymph nodes, they are protecting us from various harmful substances. They helps us to control the bacterial infection, viral infection, parasitic infection, fungal infection, a lot of infections. Also they helps to control the spread of cancers, they helps to limit the spread of any foreign substances within our body. So by this immune response, they are actually protecting us, and while building this immune response, they actually enlarges in size, and this enlargement of the lymph node is known as reactive lymph node or reactive lymphadenopathy. Lymphadenopathy means there is abnormal consistency or size of lymph node. So here the size of the lymph node is enlarged, so it is one kind of lymphadenopathy. And why it is reactive? Because it is building some reaction within our body to protect us. So this is known as reactive lymphadenopathy. So is there anything to worry about? If you think deeply, by building an immune response, one lymph node is trying to protect us. So there is nothing to worry, but you should be happy that your immune system is functioning properly. That's why the lymph nodes are enlarged and thereby they are protecting us. But sometimes these enlarged lymph nodes are the focus of focus of concern. Like we are sometimes worried whether these lymph nodes are good or bad, whether these lymph node swellings are not due to any kind of cancer or etc. But the most common cause of lymph node swelling is reactive lymph node swelling. Okay, and why this occurred? Because this is one process of formation of immune reaction. By that we are getting protections from our lymph nodes. Now the commonly enlarged lymph node that we get is in the cervical region, in the neck regions. In various groups we find this type of reactive lymph nodes in the cervical region. So why there is enlargement of the lymph nodes in the cervical region? Their enlargement is mainly due to infection in the upper digestive tract. Most of the times there are some infections within the oral cavity, it may be within the digestive tract or within chest, within lung, there may be some infection, and due to that infection the cervical lymph nodes are enlarged. It may be enlarged due to infection in the gum, or there may be presence of caries tooth. Okay, there may be infection in the sinuses. Okay, that can also causes enlargement of the lymph nodes in the neck region. Sometimes the posterior group of lymph nodes in the neck, they are enlarged due to dandruff or any infection in the scalp. So dandruff can be a cause to cervical lymphadenopathy, where the posterior group of lymph nodes are mainly involved. And it can also be enlarged due to any infection in the skin in the head and neck region. So how to diagnose? They are usually very small, tiny, round, enlarged lymph nodes. They have a soft consistency. Sometimes they are tender, that means if you palpate them there is pain. Those lymph nodes sometimes may be having some redness of skin over it, and the temperature might be mildly raised in that surrounding skin. Usually we give some antibiotics to control the primary infections. Whenever the infections are controlled, these lymph nodes are gradually decreased in size, and usually there is no need to proceed further. But if after control of the infection, if the lymph node swellings they persist, then we must proceed for some investigations like fine needle aspiration cytology or any biopsy or any kind of radiological investigation, etc. So if the infections are controlled and the lymph nodes are still enlarged, then we have to proceed further with the further investigations to find out whether this lymph node swelling is not due to any kind of malignancy or any bad thing. Okay, now how to treat this condition? So we understand the process of reactive lymph node formation. So that is the key behind the building any treatment protocol. So we have to treat the primary cause to get rid of these lymph nodes. So if there is an infection in the upper aerodigestive tract, we have to give some specific antibiotics to control them. If there is an infection in the chest, lung, then we have to give specific antibiotics. If there is an infection in the gum or any tooth, then we should also be giving appropriate antibiotic for those. So the key point in treatment of reactive lymphadenopathy is that we have to treat the primary cause to get rid of this condition. So that's it for now. If you find this video helpful, then don't forget to give us a like. If you find this video helpful, you can also share this video in social media. If you have any query regarding this topic, please comment and please share your thoughts. How do you like this video? Okay, and please suggest, is there anything that I can improve in my future videos? If you are new to my channel, then don't forget to hit the subscribe button and also don't forget to hit the all notification button, because in my channel I usually post different health related topics, and if you are interested in this topic, then please consider subscribing. Thank you.